it is nice to see that the numbers have come down by a couple of hundred from where they were, they've spent the last few days, 1,612 new cases. Sadly, 8 more deaths in Victoria. That trend line is continuing to grow and will continue to grow because of all of the cases that we have seen in the last week or two. In terms of the spread and the locations of the spread, there is still, it sounds like, a relatively large amount of spread in Melbourne, across all corners of Melbourne. The stability that we've seen in the city of Hume has really stuck, and from what the Victorian government was saying this morning, it sounds like, I think it was 169 cases in the city of Hume today, which is a lot of cases obviously, but it's a lot less than the sorts of numbers we have seen in the kind of high 200s and even 300s a day is what we've been seeing there. So that's a real improvement. Hopefully that sticks and we start to see a turnaround in that community, because they have obviously been hit very, very, very hard. Mildura, 36 new cases today in that locked down city, so that's a little bit of a concern. That clearly has spread quite a bit through that community. And the hospitalisation numbers, that hasn't updated today, so we've got significantly more, a big growth. I think it was 68 more people gone into hospital in Victoria today, a big spike on what we saw yesterday.
And Casey, today's obviously an important day for New South Wales. What are we expecting to happen with infections from here?
So what we're expecting is for at least a little bit longer we'll see these case numbers improving. We've got 496 new locally acquired infections today. The 7-day average is dropping. The hospitalisations are dropping. The deaths as well, in fact. We've got 8 new deaths today. We've seen some stability in that trend line, and the expectation would be, given the direction the other statistics are going, that the deaths would follow suit soon. So what we should expect to see is some improvement in all of those measures for the next couple of weeks. We will, however, now that restrictions are easing, start to see more pressure, more ability for this virus to spread. We'll see cases rising at some point. How quickly, we don't know. It'll depend on a lot of factors, including how are people who are unvaccinated following the rules and not going to cafes and shops and things like that, getting haircuts, and also, just how kind of actively do people start moving about the community. That will determine a bit about how quickly the cases start to pick up again. But when they do, we're hoping that the numbers of deaths and the numbers of hospitalisations do not follow suit in the same way, and they remain low. We've got some examples of countries overseas that kind of give us a case study of what we're trying to emulate here, because remember, in about 5 weeks, more than 90% of the 16 plus population in New South Wales should be fully vaccinated. More than 60% of the 12 to 15-year-old cohort should be fully vaccinated. And if you look at what's the vaccination rates in New South Wales right now, just the first dose rates, New South Wales as a percentage of the total population, including kids, is actually about to overtake Denmark, and Denmark has been living a lot freer for a lot longer. Let's have a look at what's happening in Denmark at the moment. In terms of the numbers of cases, they've had 365,000 cases through this. They're still looking at, case numbers in the hundreds every day. But since April, the 7-day average, the average number of deaths being recorded in Denmark is sort of 1, 2 or 3. And so that's the sort of case study, the examples that you're looking toward, and New South Wales is hoping to be able to emulate, or perhaps even do better, because the plan here is a bit more cautious than in Denmark. Denmark's dropped virtually all restrictions at this point, and New South Wales is obviously still living with a fair few of them. So that is the hope. That is the experience New South Wales is trying to replicate, despite the fact that we expect cases will increase in the coming weeks. Exactly how quickly, we don't know. The hope is that this chart, the numbers of people dying, will not do the same.